where there's just not enough nonprofits to meet the current demand. I'll continue working on the priority. It's a priority. The chair is opposed, and so I'm not going to seek a vote, but I do hope to get this done. We need to be creative as we provide mental health services in those areas which are mental health deserts.
And you withdraw the amendment, is that correct?
Yes.
Okay. Further amendments? Yeah, Senator Tuberville.
Mr. Chairman, I'd like to call up Tuberville Amendment Number 1 for consideration. I'd like to take this opportunity to discuss an issue that I believe is directly related to everything we've talked about in here. I believe it's impossible to discuss our nation's opioid epidemic without discussing the crisis at the southern border. You know, back in March, I introduced the Border Safety and Security Act. This legislation requires the Secretary of Homeland Security to suspend the entry of illegal immigrants into the United States until we have control of our border again, because we've lost it. 6.5 million illegal immigrants have been apprehended by the Customs Border Patrol protection since January 2021. In fiscal year 2023 alone, CBP seized 1,000 pounds of fentanyl at the border. Imagine how much fentanyl made it into the U.S. without being caught by law enforcement. Imagine how many lives we've lost. Over 100,000 a year in this country. 8 to 10 in my state a day in Alabama, not counting the cost of health care. Mental illness, I keep hearing about people training new mental health professionals, and that's great. If we don't stop this drug coming across the border, we're not going to fix anything. We're wasting our time. I'm offering this bill as an amendment to support ACT today because I think we must take a good hard look at this. We've got to do it. Finding ways to address substance use disorders is worthwhile and should be seriously considered by this committee. But unless we do something to address the supply addiction, will only continue and get worse. We will never get out of this epidemic without it. So every day we leave it open, it's becoming the biggest disaster of our lifetime. And we're in there talking about mental health people working. It is a disaster. I taught for 40 years, and I've never seen the influx of what's happening, not just in our communities, but our schools. We wonder why we have problems. It's an absolute disgrace. Therefore, I'd like to offer and withdraw this amendment, Mr. Chairman. Thank you.
Okay. Well, Senator Tuberville, of course, you raise a very important issue, but you know that that is outside the jurisdiction of this committee, and I appreciate you withdrawing it. Further amendments, Senator Mark, Senator McCallum.